Disclaimer: this content is meant for information only and not as a diagnosis or medical treatment for any condition. If you or a loved one needs help, please seek out a qualified medical professional for assistance. Welcome to the podcast. I'm your host, Katie Oshita, BSN, RN, IBCLC, and infant feeding specialist. Quench your thirst for knowledge and travel with me across the nation to discover, learn, collaborate, and better serve clients from all over the globe. Let's ride and thrive together. Today on the podcast, we have Dr. Martin Rosen, a 1981 summa cum laude graduate of Life Chiropractic College. Over the past 4 decades, he has taught pediatrics, craniopathy, primary healthcare management, practice management, and chiropractic philosophy nationally and internationally to thousands of chiropractors, chiropractic students, healthcare providers, and on public forums. He is a certified SOT advanced practitioner and a craniopath certified pediatric chiropractic practitioner, past president of SOTO USA and SORSI Research Board, former instructor for the ICPA, and developer of Dr. Rosen's seminars, and has written several books on SOT and pediatric adjusting, as well as had numerous articles published in chiropractic journals and research conferences. With his wife, Dr. Nancy Watson, they formed and run the Peak Potential Institute, offering premier educational programs for healthcare professionals. Their most recent book, It's All in the Head, was written to inform and bring awareness of the implications of growth and developmental challenges in the early stages of childhood development. Their book empowers parents with the ability to understand normal developmental milestones and to recognize problems in the earliest stages, allowing them to seek appropriate care before problems become entrenched and create diagnosable disease processes. The Peak Potential Institute also offers other educational tools, including hands-on and online workshops and seminars, guest lectures, instructional videos, written books, articles, and published research papers, and one-on-one interviews. Dr. Rosen is dedicated to giving chiropractors and healthcare professionals and parents a new perspective when it comes to children's health. As the parent of 2 daughters, Dr. Rosen and Watson have been committed to helping other parents learn from their personal and professional experiences. Through their combined 80 years of teaching, writing, and clinical experience, they have brought a unique insight and motivation and support to thousands of lay and professional individuals in numerous fields. All contact information will be in the show notes. So welcome, Dr. Rosen, to the show today. So thank you so much for reaching out to me, Dr. Rosen. I was really excited to get your book and to learn more about your practice and what the peak potential and your education and your passion about pediatric chiropractic care. Do you want to kind of just tell people who might not know, just kind of like the synopsis about how you got so specialized into this?
Sure. Thank you, Katie, for having me. I really appreciate it. We've heard a lot about you, and I think it's amazing what you do. It's awesome that you travel around and help people help their kids get healthier and stronger, and it's an amazing process. So well, it's kind of a really easy story. Went to chiropractic school, met my wife in chiropractic school in 1978. We met and we started dating and we got married and we had a baby and we graduated chiropractic school. She's a chiropractor as well, obviously. And we graduated chiropractic school and she was about 7.5 months pregnant. And so we moved up to Massachusetts from Georgia. That's where we went to school. Massachusetts, it's halfway between where we both grew up. She's from New Hampshire. I'm from New York. And so we had this beautiful, wonderful, lovely baby that was born, and we had graduated chiropractic school. And we had a premise that chiropractic helps people express their human potential and can help them stay healthy. And then we went, but we don't really know how to adjust babies because they didn't really teach us that in school.
Right.
And so we had a philosophical construct that didn't really have the tools to actualize. So we started our journey then looking, I was involved with an organization called SORSI, and I was learning a technique. And the man who was teaching, his name was D. Jarnett. He always talked about the importance of chiropractic care for kids, especially in the first 7 years of life. He said that's when those patterns really start. So that really piqued my interest, and I started studying with him. Again, back in the late 70s, early 80s, there wasn't a lot of pediatric chiropractors or chiropractic classes that you could take, but he was one of those people who supported it. So I started to learn his technique and adapt it for the pediatric practice. And once I started doing that and taking care of my own kids, it just became we homeschooled for a while. We had a lot of homeschooling families that had the same ideology. They were into one natural avenues to take care of the kids, nursing them. Some of them did home births, homeschooling things. So it became a very easy venue to kind of expand. And it was just a gas. We had a family practice. I've been in practice 40 years, and it's a family oriented practice. We have 3 generations of people that we take care of. The little babies that I was adjusting 20, 30 years ago are now bringing their babies in. So it's just an amazing process. And we've seen so many miracles over the years, and we've helped so many babies that it's not only become a passion, it's kind of become a calling.
Yeah, I mean, it's amazing the difference it can make. I think back to what I knew about chiropractic even 4 or 5 years ago, and I always kind of grew up thinking that it was more orthopedic, like, are your
Right.
bones straight was kind of how
Right.
I kind
Exactly.
of had it in my head. And then I'm very thankful for my time working closely with Jen Santos, because she really kind of opened this door for me and explained all about the nervous system and how
Yeah.
it's all about, it's much more like, not quite being a neurologist, but you're so focused on the nervous system and how the
Right.
brain is communicating with the body. It's not about, the bones, and you're not an orthopedist. You're not looking at our bones
Exactly.
straight and everything. And, that really helped
Yeah.
me. But the difference was when I started seeing, how people responded, how babies responded, the difference it would make nursing, and the difference in myself and my kids when we started getting
All
adjusted
right.
regularly.
It's about determining how structure is affecting function. And I'm not just talking about function, like you said, of walking or holding your head up, but function in the nervous system,
Yeah.
function in how the baby or the child or even the adult is responding to all activities and all stresses in their lives. So and pediatric chiropractic care is a specialty because you're dealing with a very delicate nervous system. You're dealing with a very fast growing nervous system. You're actually dealing with a bony structure that isn't even really bone yet. It's so cartilaginous, and the skull itself hasn't formed completely. It's literally a bunch of separate bones that eventually will start to fuse and form sutures. And so during this process is when you can make the greatest input. It's kind of like when you build a house, you want to make sure that the foundation is really strong. So whatever you build above that foundation can adapt to whatever stresses need to be throughout life. And that's what we're really doing in pediatric chiropractic is we're building the foundation so not only to deal with issues that may be occurring at that time, so that issues don't occur later on in life.
Exactly. I mean, I tell people to think of their babies as like this, almost like a silly buddy baby. I'm like, they're so
Mm-hmm.
moldable that they easily accept suggestions, because I'll tell
Exactly.
people when I talk about chiropractic with a client who hasn't had that before for a baby or heard of it, they'll say, oh, cracking the neck and turning all this.
Yeah.
And I always tell them, you're going to walk in thinking it's going to be scary, and you're going to walk out feeling like, did they do anything? It was so gentle. They
That
barely
was
moved the
it. Yep.
baby. And, and I say it's way more gentle than they expect, and I'll even sometimes take fingers and show them on their body, or, talk about
Mm-hmm.
2 to 4 ounces of pressure. Like, it's very, very gentle, but it is a funny thing of like, parents are really expecting this big violent movement. And I'm like, babies don't need that.
Right.
They don't
Well, I
come
mean,
in with the decades of,
right.
compensation.
Well, they don't have, I have not yet a 6-month-old yet with osteoporosis or osteoarthritis.
Right.
So, and I always tell parents that I said, the stuff that you see on YouTube, which is kind of horrific sometimes, that's not what we do. And I explained to them that adjusting a child is actually safer than adjusting an adult because of how little force we use. And so the process is actually safer. It's easier. And you're right. When I teach my classes, often I say when people, especially when they're working in the head, and inside the mouth and cranium, I said, think of it as molding taffy, as much
Yeah.
more of a molding process as opposed to, a high velocity thrust or a popping noise or any of that stuff. And it's interesting you said that because when I have new patients, if the parent has not been under care, has not seen the pediatric adjustment, I actually will use their leg or their head or anything, show them how much pressure I'm actually using on the baby so that they understand that it's 4 ounces of pressure, maybe 6 ounces at most, but not enough pressure to cause any damage, but enough pressure to help facilitate a change in the way the body is trying to adapt.
Right. I knew a chiropractor who used to tell parents it's ripe tomato pressure. She's like, you're not going to squish that tomato. It's really gentle. It's about a gentle suggestion, and babies accept suggestions so well.
Right.
It's just a totally different process. One of my favorite things is when chiropractors are really, really experienced and really great with nursing babies and will adjust while they're feeding, because
Yeah.
it's
Yeah.
a weird thing for a parent, like I said, they go in expecting a big movement, then they see very little movement and they're like, what happened? Did you do anything? Is it going to make a
Exactly.
difference? And when you do an adjustment and the baby is feeding, it's mind blowing for the moms. All of a sudden they'll be like, whoa, that totally just changed the suck. Or, oh my gosh,
Yeah,
this latch just got way deeper. That
exactly.
feels so different. I feel that pull now. It's very affirming for the
Yes,
nursing parent.
and you're right. There's not so many layers of compensation. So just taking care of kids is a much quicker process, as far as seeing outcomes, because they don't have years and years of compensatory problems or patterns. So it's quicker. You can adjust to a nursing. The other thing that I do, and I've done it, and parents, are amazed. I've actually adjusted a baby while they bring it in sleep. They said, "Oh, should I wake him up?" I go, "No, don't wake him up. Just lie down with him." And
Mm-hmm.
I'll actually adjust the baby with them on the parent, the whole adjustment, and the baby will stay asleep.
Yeah. Yeah, I know. I always tell parents they should sleep through it or they should be comfortable and happy through it. If they're screaming and crying, it's not going to work. So
Right.
we're either just having a bad day or something else is
Well,
going on or
I
but
will have to say that sometimes they may cry a little bit, but only because in some of the adjustments, you have to, like, especially if they're dealing with nursing or sucking issues or tongue tie issues, you do have to hold their head in a position while you make the correction, and they may get angry at that. And I'll tell parents, like, watch, as soon as I'm done, she's going to
Mhm.
stop crying, and they will. They might cry a little bit, and then as soon as I'm done, they'll stop. And basically, what they're telling me is, I don't want to keep my head here. I want to
Yeah.
move it, and that's okay,
Yeah.
But you're right, not screaming, yelling, and you don't want to, just like, an adult, when you want to adjust them, you don't want it to be really tense when they're adjusting them. You want the baby to be
Exactly.
as relaxed as possible. But, if they're crying a little bit, that's usually not, that matter of fact, it's usually not a problem at all.
Yeah.
But right, you got to be, you have to, like I said, it's a whole different art form than adjusting adults. And that, you want to bring your child to somebody who specializes in pediatric care, not just somebody who's just, a general chiropractor. Oh, I've adjusted kids once in a while.
Right. I always tell them, if you're, my preference is to go off the ICPA list or to
Hmm.
look around and try to find someone who really
Right.
sees kids regularly. And, but sometimes they'll say, well, I have this chiropractor who's in my insurance. Can I go there? And I say, okay. I said, call and ask them if they see kids. And if they
Right.
say, if they take the phone away for a second, they're like, hey guys, do we see kids? And they're like, yeah, we saw one last month, anytime. Don't go there. Like,
Right.
or if you walk in the office and they look like they've never seen a kid and they've got like
Exactly.
breakables on the floor and just
Right.
big drop tables, and then they're not really comfortable with kids. If they don't know how to hold a kid, then they're probably not a good pediatric chiropractor for you. So I always tell parents, trust your gut. Like,
Well, the other
you
thing I
walk
always
in.
tell people also when they're calling, but trust your gut. And when I tell them when they're calling an office, if they say they see kids, you just ask them what percentage of your practice is pediatrics or what percentage of your practice is family practice. And they, I mean, if they say 30, 40%, then you're in a good place. If they say, well, we see a couple of kids once in a while, or, maybe 5% of my practice, then you may want to look somewhere else. You
Right.
want somebody who's at least that focuses. You're right. And when you walk in a waiting room, like in our office, as soon as you walk in the waiting room, and you step in the door and you look straight ahead, there's a wall with 200 pictures of, it says our chiropractic kids, and it has pictures of all, not all of them. We change them all away because
Mm-hmm.
it's only 200 that we fit up there. But right away that, oh, well, their kids are welcome here.
Yeah.
If you see a practice that looks very sterile and it doesn't look like there's kids welcome, like you said, it doesn't look kid friendly at all. It's like if you go to pediatric dentist. And their head is rounder when it comes out of a C-section. It doesn't get
Yeah.
misshapen. Well, yeah, I mean, I tell, one of the things when the baby's in the uterus and then the baby comes down the birth canal, the amount of pressure and compressions, the mom obviously feels the contractions. Well, guess what? The baby's feeling those contractions too. They're increasing tenfold the amount of pressure on the baby's spine and cranium as it goes through the transition period. It goes from like 10 millimeters of mercury to 100 millimeters of mercury. And then think of all the other things that happen where the baby may be posterior, or they get hung up on the pubic bone, or the cord gets wrapped around their neck, or during the birth they get stuck and they need forceps deliveries or vacuum delivery. And the C-section. Yeah, C-section is intensely stressful on the baby and obviously the mom as well.
Yeah.
But there's no contractions pushing the baby out, so they actually have to yank the child out. It's a lot more pressure actually in a C-section delivery than there is in a regular delivery.
Oh,
So you
yeah.
have all these nuances that can cause stress on the baby's spine and cranium. And people bring their kids to a pediatrician to get checked, right? And they weigh them and they check their head and they do PKU. I mean, they measure their heads, they do PKU tests, they do all this
Mhm.
stuff. Well, chiropractors are specialists in determining how the nervous system is functioning and the cranium and the spine. So why wouldn't it make sense to go for your well baby checkup to also bring your kid to a chiropractic check if anything during the birth process was traumatic? One of the things
Absolutely.
we look at and ask parents is, what was your child's ABCAR score? If the ABCAR score was low when the child first came out, that means the birth was stressful on the child. If you have a 3 or 4 or 5 in ABCAR score, that's a very stressful birth. All right. So you need to, so that's kind of the one, the monitors or parameters that we also use to help determine the stress on the baby when it comes to how the birth was affecting them.
Well, and I think of how much it makes a difference too in the pregnancy position too, because I had my first pregnancy was going okay. And then at 34 weeks, she turned breech and she
Oh,
got her head stuck up under my ribs. And we
oh,
tried, external version and
right,
acupuncture and pool and like a million things. And she just wouldn't turn. Well, she
right,
was born with torticollis. And it's like,
right.
I'm pretty sure that was 6 weeks of her head being wedged under my ribs. And it was quite uncomfortable. Like it was a very uncomfortable position for me. And I'm sure it wouldn't
Sure.
have been comfortable for her. And so she was born with torticollis. And I think that it's important to recognize that just because they're hanging out in the uterus doesn't make it comfortable. Like even just a
Right.
singleton, it can be very uncomfortable and cause structural issues,
Sure.
which wind
Well,
up
the
causing
position,
functional issues.
right. Well, the position of the uterus and the tension in the round ligaments and the pelvic fascia and the position of the tailbone, the sacrum, and the hip bones all are dependent on how the baby lies in the uterus and how the baby is able to be born and how much pressure is put on the mom as well. Right as you get pregnant further along and the belly tends to extend further out, it changes your center of gravity and puts more stress on your low back. One of the common things that mothers will come in is they'll have sciatica because they have pain because it stretches the lumbar spine, puts stress on that sciatic nerve. But the other thing that's happening is it's distorting the pelvis. And so when the pelvis gets distorted, it can tip the uterus. It can make not only the birth more difficult, but the pregnancy more difficult. So chiropractic techniques, there's specific techniques designed to help make sure that the pelvis, the sacrum, and the fascia, which is the soft tissue that goes or the transverse across it, is more balanced. Also, the pelvic inlet and pelvic outlet has to do with the relationship of the tailbone and the pelvic bones. So chiropractors can also help make sure that that's aligned correctly. Often what we do is we have certain techniques that when we make adjustments that babies who are breech will actually turn, because when you change the structure in the pelvis, you change the tension on the round ligaments, you change the tension in the uterus, and the baby then has more room and can actually shift positions. And so, yeah, so it's extremely important for moms as well as the pregnancy gets on and they start to gain more weight, they start to get bigger and they get more fluids in the body, is to get their spines checked as well, because it's going to be beneficial to both them and to the growing baby.
Right. I mean, I think it just makes such a difference. And I wish it was something that everyone knew. And,
Right.
like you said, they just would go to have their well check. I mean, I would love to see a ton of different things. I'd love to see
Right.
lactation be involved in that first check. I'd love to see them also then
Yeah.
say, hey, send the baby off to, the chiropractor, get your first chiropractic adjustment and make sure that babies, I think there's so much in this country too, where we're also chasing problems instead of preventing. And it's like we're always trying to defer cost or time or whatever it is. And it's
Right.
like if you would just put a little bit up front, right, we
Yeah.
wouldn't have the problems. And
Well,
it's
yeah. Well,
really very unfortunate.
Well, as a lactation consultant, just the way the baby nurses can affect the way they get the food in and how much air they suck in. If they suck in too much air, their stomach gets bloated and they end up with, and I'm doing air quotes here, colic. And it's not really colic or anything wrong. It's just that they're not latching correctly and they're getting half milk and half air and they're getting full faster, so that's something that between chiropractic and lactation consultants, we could easily see that that's an issue and help change that and mitigate that instead of putting your baby on Prilosec or Zantac because they have, or silent reflux or whatever you want to call it at this point, that is actually caused by their inability to nurse correctly and to take in nutrition correctly. So you're right. We need to look at things to prevent that as opposed to things that we're looking at to treat the issue. If we could prevent an issue, it's a lot better than trying to treat it.
Absolutely. And I think the colic and the reflux are two huge things. I mean, technically, none of these drugs are approved for babies.
Right.
None of them.
Yeah,
and yet
right,
they're
exactly.
used for them. And they're not meant for babies. They're not,
No,
and they're not without risk. That's something
absolutely.
I feel like informed care needs to be really covered a little bit more. And we need to really understand that everything comes with risk, right? I mean,
Everything.
everything has pros and cons. Everything has some sort of risk and benefit that we're looking at, but they're not
Absolutely.
clearly presented. And that's
Yeah.
a really big issue
Huh?
because too many babies are getting, very early intervention of just, start these meds. And I mean, I even
Right.
went through with my kids. It was for something different. They wound up doing allergy shots, which was just a whole nother horrible
Right. A whole
incident.
nother. Right.
Oh God, terrible.
Exactly.
But for 6 months, twice a week, they took 2 Zantac and 3 Zyrtec in order to be able to tolerate the allergy shots, and they still reacted. And then, of course, Zantac got recalled for causing cancer. And I'm like, well, how? Now my kids took it for 6 months, twice a week, a double dose. And I'm like,
Uh-huh.
oh God, what risk did I do? And I
Well,
feel horrible, but
right. But
we
you didn't
don't
know.
know. Right.
Right.
But I think
Well, one of the things like Prilosec does is it blocks calcium absorption.
right.
So do you want your
We're
baby to
seeing
not
bone
get a
loss.
proper amount of calcium? Right.
Yes.
They don't tell you that. And I think it was 2 years ago, Prilosec and Zantac were the number one drugs prescribed for infants,
Yeah.
which is crazy because, as you said, they weren't even originally approved for infants to begin with. But
No,
yeah,
they're not.
decreasing baby's stomach acid, which is necessary to digest food, causes a whole host of problems down the road. The food doesn't break down well. It can end up with gut issues, all those other types of things that happen, digestive issues that can happen. They don't get proper nutrients. As I just said, it blocks calcium absorption. And then when they take them off of it, sometimes the kids get a wicked rebound and, they start to produce too much acid and then they start to burn again. It just becomes a vicious cycle.
Right. And I think the kind of the crucial piece here to also look at is they're not actually treating the problem. Like
Right.
it
No.
isn't an
Right.
overproduction of acid. They're not
Exactly.
having heartburn like an adult will. They're a completely different
Exactly.
human. They're having almost, I'd say, most of these babies on reflex meds are having air induced reflux.
Right.
They're having
Exactly.
airphagia. They're just getting air in because their mouth isn't sealing. They're not getting a good latch on breast or bottle, and they're pulling in air. So even if we had drugs that were lower risk, we're still not treating the problem. We're just trying to
Exactly.
cover it up.
Right.
We're not fixing what's actually wrong.
Well, there's a saying that says that, drugs are, in many cases, drugs are used to allow you to continue the same lifestyle, but just mitigate the symptoms of it and not make a change. And the perfect example is what you're talking about there is that, yeah, air induced reflux is one of the things. The other thing that happens is that most people, especially older people, when they start to have digestive issues, it's not because they have too much hydrochloric acid, it's that they have too little and the food isn't breaking down, or they're eating stuff that doesn't break down. It putrefies in the stomach. And when it putrefies in the stomach, it creates gas. It pushes up into the valve near the esophagus of the stomach. It opens that up and it allows stuff to escape from the stomach that shouldn't. And so it's not too much. It's too little. It's food's not even breaking down.
Yeah.
And
It's
we have to look at what
we have a
hard.
culture of taking medication instead of making lifestyle changes.
It's easier, right?
We want a fix.
Isn't
We
it
want a
easier?
quick fix. Yeah. Oh, absolutely. I mean, I can't tell you how often I'll even hear from people, well, I don't have time to like eat a perfect diet. Just tell me a probiotic that's going to fix it. And I'm like, it doesn't work
Exactly.
that way.
Exactly.
What
No, it
we
doesn't.
eat is hugely important in our body. And, when I'm dealing with breastfeeding moms, what they eat is doubly important because it's affecting them and the baby.
Exactly.
And I'm actually not a huge proponent of just taking moms off foods for, no reason.
I'm
I
not
think that,
either.
I think there can definitely be warranted cases. I've worked
Yeah.
with a lot of moms with gut issues, but I also think that it's important to not just remove something and say, hey, just come off dairy and soy and gluten, but to
Right.
talk about what to replace it with, and to also talk about how to heal their body so that
Right.
their body isn't having all these inflammatory issues. And I think that, we're seeing a lot of
That's really
babies
important.
now that are already coming from parents that weren't seen and weren't, I mean, I can't tell you how many babies I see where the parents say, oh my gosh, I have a tongue tie, don't I? Oh my gosh, I have all those symptoms. So we're
Exactly. It's true.
seeing this second generation that the parents are untreated as well. And so, yeah, the parents are having gut issues. The parents are having functional structural issues from not being
Right,
adjusted.
that haven't been addressed. Exactly. Well, the other piece, and you made a really good point, and the point around it was you don't want a mother to not be able to eat a fairly well-rounded diet because not only is she not getting the nutrients, but either is the kid. So if you've been pregnant for 9 months, now you're nursing, the baby's taking your food supply, and you can't eat dairy, and you can't eat gluten, and you can't eat citrus, and you can't eat soy, and the list goes on. And there's like three things that you love to eat
Oh
that
yeah,
really restrict your diet and your ability to take in nutrients. That's
absolutely.
one. And then the other thing, the baby doesn't gain weight as much, maybe because they're not getting nutrients. And the pediatrician will say, like, oh, well, then you should supplement with formula. And then the baby starts to get more gastric issues. And, there are good formulas out there that can help. But most of the formulas that people get, if you read the box or
Oh,
read
they're
the label,
terrible. The
they're
US
not food.
formulas. No,
I
I mean, the
said,
number
I
one
said, read
ingredient
that.
is corn syrup.
Right. I said, does that sound like food to you? Like, read the bottle. That's not something you'd want to eat, but then the baby gets a little fatter and everybody's happy. And, sometimes getting fatter is good, but sometimes getting fatter is just a sign of inflammation,
Right.
you know? Yeah. So we need to, you're right. I totally understand that parents go on overwhelm, especially if it's like a second kid or, if they're having twins or whatever it is, or life changes and it's really hard. But I think it behooves us, and it's our job as healthcare practitioners, like you as a lactation consultant, me as a chiropractor, to at
Mhm.
least make the information available because they're not going to get it from the medical world. They're just not going to get that information. And so
Right.
they need to get that information so they can make informed decisions.
I totally wholeheartedly agree. And my attitude is I'm not a gatekeeper. It's not my decision to decide what is right for you. It's not my decision to judge and tell you this
Right.
would be too hard. You can't do this kind of diet. No, I'm not going to judge and make any decision for somebody else. So my job is to just present all the information that I have. I also am very big proponent of knowing my scope, knowing my limitations, and saying, hey, this is where my knowledge ends. This is where you might want to pull somebody else in. This is where you might need some
Exactly.
extra support because nobody can know everything. But
Exactly.
I'm not a gatekeeper. I'm not going to decide for a client that things are too hard or that they won't, be able to do it or
Right.
anything. That's not an
Well,
appropriate thing.
well, the other thing is parents have to watch their kids, see how their kids respond. So that's one of the reasons my wife and I wrote the book. It's all in the head. We did it during COVID.
What a productive COVID thing. Everybody
Yes, it
else is
was. Want to normalize dysfunction. So that's part of the reason. It's like, oh yeah, Johnny's kids on Johnny's kids on Prilosec,
Mhm.
they had to give up nursing after 3 months, and then they give you a list of all the people that have the same issues that they're having, and they feel safe in that, saying, oh, that's normal. Then it's like, no, just because it's happening to a lot of people, still doesn't make it normal.
Yes.
You
I
know, so
mean,
that's one of the reasons we did that.
I say that all the time. I say this
Mhm.
country is completely confused
Right.
common with normal, and we are normalizing dysfunction. I have this little mouth model that I use with all my virtual clients, and it's a piercing model. It's really funny
Yeah.
looking. It's silicone, and it helps me show exercises and
Oh,
anatomy
great.
for doing the exam and everything because the parents are my hands. But
Right.
what's really hilarious to me is this is sold as a piercing model for like some piercing studio or whatever. It has lip blisters all over the lips. It has a deep central groove and it has a very apparent mid tongue tie. Like you can totally see this frenum. This tongue has this huge groove. I'm like, this is supposed to be normal. And this is a completely tongue tied adult. I mean, I cut out the teeth, so
Uh-huh.
now it looks more like a baby. But I mean, it's
It's
just hilarious to me that we're normalizing dysfunction to the point where we don't even know what it looks like anymore.
it's so funny you said that because what was the impetus for the book was my wife, and what happened was I think we were in Kansas or somewhere teaching a seminar. Anyhow, wherever it was, we had forgotten our baby doll that we use as a model. We
Mm-hmm.
have one. And so we went to like a Toys R Us to try and find one. And my wife Nancy goes, she goes, look at all these baby dolls. They're all distorted. Kids aren't supposed to look like this. She goes, they're all twisted. Is this what people think babies look like? And so
Yep.
she had the same response. She said, we have to tell people that this is not what a normal baby looks like. They don't look twisted like their lip shouldn't be in this position. Their eyes shouldn't look like this. And their head shouldn't be this shape. And that was the impetus that she got behind to actually put this book together was because of that. So it's funny
Absolutely.
that you said that about the model you use. Yeah.
Right? I mean,
These
it's
are the
like,
models.
kid, do you know anyone who doesn't know someone who snores? I don't think
No,
any
I
of us
don't
know
know.
someone who, I mean, everyone knows someone who snores, and they're all like, snoring's normal. That happens to everybody, especially like,
Everybody snores. Yeah.
dads and grandpas and even kids. I mean, it's normal, right? And I'm like, no, not
No,
normal.
no.
We should be breathing silently with our mouth closed,
That is
nasal
true.
breathing when we're sleeping. But
Right.
again, we're just totally normalizing dysfunctions. I think one of my favorite parts in the book, and I have it kind of bookmarked here, is this milestones and reflexes because again, we're trying to explain what is normal because it is not clearly understood anymore and it's so muddy, that water. And I love that you have them broken down into like little age check marks and kind of like some of it's feeding and some of it's movement and some of it's talking.
Right.
And so it's
Exactly.
different things, but you're showing what are these normal things? Where should this baby be at 3 months, at 6 months, at nine
Exactly.
months? And
We
there's always some variation. I mean, we're all human,
absolutely.
but if you have something that says, in the 3 to 6 months range, they should be doing XYZ. I mean, at 3 to 4 months, they should turn their head towards a bright light and color. And if they're 5 months and not doing that, there might be something to check out,
Nice time to check it out. That's what scared us was this year, the CDC put out new milestone
Oh
guidelines.
my God. Yeah, those
I
were
right. And
horrible.
what they did, and so what they did is they changed not only did they leave out creeping and crawling,
Mm-hmm.
which is horrific, but they basically lowered the bar and changed all the guidelines. And the rationale behind it, so this is the rationale, this is how scary it was. Rationale was that they were finding over the last several years that only 50% of the children were actually reaching the milestones as had been purported over the last number of literally generations. And so they
Yep.
felt that that was an issue. So instead of finding out why, they lowered the guidelines, and now they're very happy because now 75 reaching the milestones. And I'm like, are
Yeah.
you listening to what you say? Like,
Yeah.
you're basically saying that, now passing grade is no longer 70, but passing grade is now 50, and now we have more people passing, so we're smarter.
Yeah, exactly.
Yeah.
And I mean,
It
the
was,
whole crawling thing has just been such a nightmare because crawling is
oh
so
yeah,
important. And when I tell parents out, they're like, really? It's not a milestone anymore. And I'm like, I know, but it's
it's
hugely
got to
important.
be though.
And this is definitely one of those areas where we have normalized dysfunction because all those babies that army crawl or, they pull one leg or they just scoot on their butt or, all this stuff. And we're like,
Right.
oh, that's so cute. Look at how they found a way to get around. I'm like, now I just look at them and
Exactly.
I'm like, dysfunction, dysfunction, dysfunction. I'm
Right.
like, but it's
Right.
really sad.
Or the parent who thinks their child is special genius because they went from sitting to walking and never got to
Mm-hmm.
crawling. Like, my child's special. Parents say, look, the way your child develops, like being able to pick up their head, being able to roll over, being able to sit, being able to crawl, stand, all that stuff, those are already pre-programmed into the nervous system. You see, and the ability for that to happen is a nervous system that's healthy, and these pre-programmed milestones occur. And again, there are windows of opportunity. It does, it has to be everything in 4 months or this in 5 months. There are
Right.
windows, but those have to be developed. And I said, look, if your child had to live in the wild, if you ever see an animal in the wild that's born, they can actually walk within a couple of hours, because if they can't get up and walk in a couple of hours, they're basically food for some other predator. And so that is how they've developed time. And those are pre-programmed. And you're a kid, yes, it's in a protected environment, but these they're called pre-programmed proprioceptive feedback loops that
Hmm.
fire off at certain times. If they don't fire off correctly, that's a neurological dysfunction. And it can be
Absolutely.
detrimental later on, especially creeping and crawling, which helps integrate the nervous system.
Absolutely. I mean, crawling is such an important milestone. And this
Oh,
just
yeah.
goes along in that box of things I wish I knew 13 years ago when I first became a mom, because I had two very funky crawlers. And, I
Yeah.
wish I had known, but, we didn't, and nobody told us. And now I know all sorts of stuff now that if I could go back, but it's,
Right.
we are just normalizing all of this instead of trying to find out why are we failing the children? Because they're not failing. Let's be clear on that. I mean, babies are babies. They do everything. They're the most
Right.
primitive, basic creatures without any ulterior motives. Like, I mean, a 3-month-old is operating all on reflexes in a purely survival state. They are so pure in their thoughts,
Exactly.
We are failing them. And instead of having to take
Right.
that
We
hard
are.
look about how we're failing and how this country is failing babies, we just change it and say, oh, look, now we're succeeding more. It's alarming.
Yeah.
And the problem is going to be in 5 or 6 years, this is all going to be school age kids who have more and more dysfunction.
Well, in 2019, I think it was, the Health and Human Services came out with the statistics that 54% of our children have chronic illnesses, including learning disabilities, neurological issues, and health, other health, asthma, immune system.
Mhm.
But they just came out saying 54% of our children have chronic issues, chronic diseases. I'm like, does that not scare anybody?
Yeah.
When I went to chiropractic school, the autism rate, the number was 1 in 2,500. Now it's like 1 in 38. So
Yeah.
again, does that not scare people? Like, why aren't we looking at why that is happening instead of just saying, oh, let's set up programs that we can treat all these autistic kids? I'm like, well, you're going to lose the battle, because if it keeps going at this rate, it'll be one out of every other kid is autistic. And
Yeah.
how are you going to deal with that?
Yeah.
So
And
you're right. We have to look at all these factors.
yeah, I just think that it's really sad. This country has been failing kids for a long time. I mean, look at our SIDS rates. Our SIDS rates compared to any
Yeah.
other industrialized country. Look at our maternal death rates. Like, we are
Right.
not,
Infant mortality rate. We're
yeah,
only like 11 with infant mortality rate.
which is
Yeah.
pretty alarming. I mean, we're supposed to have the most amazing healthcare system in the world, right? We've got all these amazing medical schools and everything else, and yet we're failing people every single day. And there is not one answer. And that's what I tell people all the time. We're not looking for one thing. There isn't the answer that's going to fix everything. It's going to
Right,
be
but
a whole selection of things that all have to come together.
we have to look at a different model, because we have the most expensive healthcare system on the planet. We spend twice as much as any civilized country on our own individual healthcare. And you're right, our infant mortality rate, and we're only like number 41, in the healthcare regime. So we are spending more money than any other country on this planet, and we're not healthier. So
No, we're
that is
not. I
not the
mean,
end. It's not pouring more money into the same paradigm. It's about finding a different paradigm.
oh, and it's definitely not just the babies that we're failing. I mean, then you
Oh
start
no,
looking at
no,
the
it's
number of
yeah,
adults with diabetes, heart disease, obesity. I mean, we're
right.
failing people in general, and we are not healthy. This is what, the first generation where we're really truly have a shorter life expectancy and not
Right.
healthier
Our
than
life
we are.
expectancy is this first generation, you're right. First generation, that their life expectancy is not necessarily higher than the generation before.
Right.
Yeah.
And
And we
I
just
tell
keep
people
going
all
the
the
same
time that
way.
there isn't one answer. We need, like you said, we need a whole system change, but you have to look at what you're doing. You have to look at what you eat and how you live, how you move your body, how your body feels. What's it trying to tell you? And babies, again, are
Exactly.
so pure. They're trying to tell us right away. And like you said earlier, when you turn a baby's head and they cry, a lot of times that's what they need. I mean, that's what I'll do with parents too, is we'll do an exercise and I'm like, well, if they cry and they really hate this exercise, say we're walking on their side.
Right.
then that tells me, number one, they need that movement, but usually
Right.
we'll have to find another way to do it. A lot of times we can do a movement on
Absolutely.
mom, like
Right.
mom will rock, and then
Yeah.
we can get baby doing it. But it's really interesting because they're so in tune with their bodies that they tell us exactly what they need and where the dysfunction is if we would just pay attention.
Well, when we teach chiropractic adjusting to students and chiropractors, we teach two techniques. I mean, we teach a lot, but I mean two modes
Mm-hmm.
approaching the baby. We call it the direct and indirect method. And basically, the direct method is going into the direction that you think things need to be corrected. But if you see that the baby's resisting it, then you have to pull back and basically go indirectly, which is basically find a way to make the baby comfortable before you move into that process. So it's kind of just what you were saying, you don't want to force through or fight through this pattern because babies are very intuitive, but
Mm-hmm.
you want to be able to help them get the job done. So sometimes an indirect approach where they are no longer feel guarded or feel unsafe is necessary to make the proper correction. So that's part of what you're talking about, is that their system is very sensitive and very tuned, and you have to be able to know when to push it a little bit and when to back off a little bit too.
Absolutely. And that comes with experience and stuff. But
Right.
there's ways of doing things. I mean, I find babies respond really well through movement, So like you said earlier too, like the parents holding the baby, a lot of times that will be an easier adjustment, or the parents
Yes.
nursing, that's their
Yeah.
safe space and they can relax. And, so I always tell them there's always another way. Babies show us what they need. And maybe we can't take door number one,
Right.
that, the easy, whatever,
Exactly.
that's where we were going to go, but there's always another option,
Right.
you
Right.
know?
And chiropractic, pediatric, like in our office, we have one table that is a hippopotamus. We have one table that's a giraffe. And, you get to be 2 and 3 year olds and kids like that. I've also adjusted kids on the floor under the table. They play under the height under the table,
Mm-hmm.
and I have to crawl. So you have to be able to adapt to the pediatric practice and the pediatric needs, because it's not like you're gonna give them a rational decision, rational choice. In our office, the other thing that kids love is we have stickers. So they love getting stickers. And my wife, Dr. Watson, who she works front desk, she's retired from seeing patients right now, but she runs the office. They come, I think half of the kids come in more for the stickers than they do to get adjusted. But either way, they come in,
Mm-hmm.
and that's okay with us. But, you need to give kids what we consider added value experiences to
Yeah,
help them be more comfortable. And it's okay to reward them for doing things that are good. It's okay if
absolutely.
they get adjusted and they go get a sticker. It's okay to reward your child, for doing the right thing.
It's absolutely. I'm a big fan of motivation. I mean, I had a parent the other day saying,
Right.
isn't that kind of bribing? And I'm like, whatever. But you know what?
Right.
We all need motivation. I mean, there's plenty of times where, and sometimes it's a negative motivation. I mean, you don't speed down the freeway because of the negative of getting in an accident or the
Right.
really expensive ticket or
Yeah,
whatever. But
right.
sometimes a positive motivation is nice. You go do a workout. Hey, now we're going to go see a movie
Yeah.
and have some fun, right?
Right.
Like we all do that as part of life. So why wouldn't
Right.
we do it with kids?
You
It
also
doesn't have to be a negative association.
Well, right, and you also have to remember that kids aren't using their prefrontal cortex, making those kind of decisions like you just said, like, "Oh, I'm not going to speed down the highway and get a ticket." Kids don't usually think like that. I have a patient who was a child psychologist, and I was talking to her about that, and she said, there's really not such a thing as bribery for children. She said bribery is really about giving somebody something that they think better than the task they're going to do, even though they know the task they're going to do is not quite on the up and up. And so you're basically, bribing them to do something that they don't want to do or they feel is wrong, but the reward is worth it. And said, but giving kids motivational support, because they're not thinking in
Mhm.
that prefrontal cortex way, is a much different factor, and is actually a healthy thing for them to be able to do, to understand that when they do certain things, they will get a positive reward. That's how they develop kind of their moral compass.
I love that explanation. That's totally
Yeah,
true. And I think
I
it's
thought it
just,
was great.
I think we all want some sort of intrinsic motivation to do things. I mean,
Yeah.
that's what's going to drive us. And so with kids, it can be very simple. And a lot of times with parents, I'll remind them that it doesn't have to be. Sometimes it isn't a thing. Sometimes it is literally you as the parent. All they
Right.
want
Right.
is, especially when
The time.
I see more toddlers lately because they're just, when these things don't get dealt with, they just become bigger things later. So when they have been ignored
Absolutely.
as babies, I see them as toddlers. And, we'll use things like stickers, but sometimes we'll use reading time. Sometimes we'll
Uh-huh.
use we'll set a timer and have cuddle time with mom or pick out
Yeah.
toys or
Yeah.
go for a
Anything
walk
like
or
that. Sure.
but sometimes all they really want is that one-on-one attention that's totally undivided. Like no phone, just 5 minutes of let's go sit and look at rocks. Like kids
Yeah.
can be so simple
Absolutely.
and we make things so overly complicated as adults, but they really are quite driven by really basic primitive needs and they need
Yes.
that connection.
Well,
That's
they're functioning from a primitive brain. I mean, they don't, the brain develops from the primitive centers in the base of the skull, moves up to the midbrain, and then finally into that cognitive region. And through each growth period and through each period of time, they're functioning, like you said, they always feed back into basically what I feel is two things. They feed back into what causes them pain and what causes them pleasure. And that's a primary response. That ability to determine what is painful, what is pleasurable to you, actually develops in the third trimester of pregnancy. So they're already setting up a paradigm for they know what makes their body feel good and feel bad. And you're right, it's a primal need. People want to feel good about themselves or feel good. They do not want to suffer. They don't want to feel pain. And it's very primal. So you're right. 5 minutes with mom holding me and paying attention to me and not on her phone or not being stressed out might be all I need to make me feel that pleasure, to create those endorphins for me to calm down, for me to relax.
absolutely.
So you're right. It's often very simple.
And it goes both ways, because you can
Hmm.
get a 3, 4, 5 month old that will stop nursing because it's causing pain, because they're having,
Yep.
they're having air induced reflux or they're having, a lot of symptoms and, or their tongue is exhausted. It's causing
Right.
pain. And so they
They're
will just
exhausted.
kind of
Right.
stop because the reward isn't enough. They don't feel
Exactly.
like the food amount that they're getting is more than the work and the pain they're going through. So sometimes they'll just have feeding strikes and those can be
Exactly.
very stressful for parents, but I'm always trying to remind them that, the baby is from coming from such a place of survival that this is a big alarm bell. This is a baby telling
Exactly.
us that, I really need some help here because these things aren't working for me. They're
Yeah.
hurting,
Right. I'm not playing. Yeah, yeah. People sometimes think the kid is playing them. Like, oh, my kid must be playing them. Like, no, your kid's not thinking
Oh,
that way.
yeah.
One of the things that we find really common around that is also you'll find a kid who is nursing well, and then somewhere around 3 to 4 months, all of a sudden they stop nursing well.
Hmm.
They have difficulty, and often we find one of the reasons for that is because they actually have hypersensitivity in the back of their palate, like they have a
Hmm.
hypersensitive gag reflex. But in the beginning stages of nursing, they're not sucking hard enough to pull the nipple back that far.
Yeah.
And so when they start to get stronger and actually more efficient, they pull the nipple back and they hit that area that's the gag reflex and they pull their head off and they'll pull away from the nipple. And that's a very common, it gets, like you said, it's very frustrating because here you have a parent and child who's been going along for 3 months and everything looks great and grand. And then all of a sudden at 4 months, the child's having difficulty and they're gassy or they're pulling off and they won't nurse. And very often it is because of the way the palate or the tongue tie has not allowed that back area of the palate to desensitize enough. And they're actually slightly gagging.
Yeah. I
So
mean,
those are things that we look at.
3 to 4 months is kind of a perfect storm age. I mean, you've got
Yeah.
developmental leaps that are happening, but
Right.
you also have a big change for mom. We have had a very hormone directed milk supply, and now we've
Right.
transitioned into really a supply and demand, a milk removal. And so a lot of times those are the babies that I'll call fat, farty, fussy babies. Those are ones that
Yeah.
they were gaining well and they were a little gassy, but whatever, they were fine.
Right.
They might have been a little fussy, but they were big and chunky and so everything was fine and mom had plenty of milk, and then all of a sudden at 3 to 4 months it all kind of perfect storm and falls apart because her milk supply drops because it's not being pulled anymore and her hormones have
Exactly.
changed, and that baby that was riding the letdown now has to do work and they can't. Their sucking
Right.
reflex and their rooting
Yeah.
reflexes are both integrated by then too, so now we don't
Yeah.
have that drive to just suck.
Yeah. Well, it's a
So
big milestone. In the first year, every 3 months or so, there's huge neurological leaps and huge developmental leaps. So you're right. So you've got moms going through their hormonal changes and their transitions. You have the babies going through neurological input and getting many more messages and much more input into their system that is more easily to distract them from something that they were able to compensate for before.
oh yeah.
So yeah, it's
And then, I
yeah.
mean, then if you get started on the 4 month, if we get out to 4 months, they do get so distracted, right? I mean, it's just
Uh-huh.
even a good nurser at 4 months, they'll be nursing and then they'll whip off the breast and turn to the side because they're like, there
Right.
was a noise over there. And they just start to really develop being able to see and understand that there's a world beyond, 2 feet, and it's so exciting. And so that's also a really common thing. And then these dysfunctional babies, what I'll see is they'll stop nursing during the day and they'll nurse all night long. And mom will be like, they used to sleep through the night. What happened? And I'm like, well, they got to eat somewhere, got to get the calories, and it's just too hard during the day.
Well, the developmental milestones that we just talked about also coincide with social milestones. Like you said, when the baby starts to reach out, starts to recognize other people outside themselves, the primal reflexes start to wane so that they're actually starting to interact with their environment. They start to learn what pleases other people. They start to create a self. It's like we talk about the terrible twos. It's really a baby finding independence. Their prefrontal cortex is kicking in. They're able to walk now. They're able to explore their own world. They're creating independence, and they're trying to find themselves. And that happens throughout that whole process as they get more developmentally integrated. They basically, like you said, they get more input. They see more input. Other things are more interesting to them, or as interesting is actually nursing. And so they need to find other ways other ways they get distracted in other ways, and they tend to pull off. And if it's a difficult process, if they're already having a difficult time doing it for some underlying issue, then they're going to give up on it. They're going to pick the easy road at that point in time.
Yeah. Yeah. 3 to 4 months is a very big perfect storm. I see a lot of clients at that age because they think everything was going fine, and then all of a sudden it falls apart. And of course, when you and I look back, we can see all of those signs, and we can tell them and help them connect the dots. We can say, okay, well, your baby was really gassy, and your nipples were lipstick shaped, and they weren't sleeping well, and and they've got this head tilt, and all of those things, and we can help them connect the dots. It didn't actually come out of the blue, but to the parents who don't, like we said, they don't understand normal milestones, what's normal versus normal function versus dysfunction. And so they were told everything was cruising along. They were fine. The baby was gaining weight. I mean, I can't tell you how many times I hear from clients that is the number one thing. That is pretty much they walk out of the pediatrician appointment and they say the weight is good and they got their immunizations. And I'm like, okay, but there's other things to do, right?
Right. They put them on the height weight scale. And if their baby's in a good place on the height weight scale, they're happy.
And if they're not, they hand them a pack of formula and they say, here, start this. They don't even, I mean, it is so rare to find a pediatrician that even remotely says you might want to find an IBCLC. I'm like, we are literally feeding specialists, and yet they are not referring. They're just passing out formula. And like we said, the formula in the US is pretty gross stuff to begin with. I mean, it's not something to grow a healthy human on. And I know we need it. I know that we absolutely, truly need artificial formula. We need this because there are people who cannot nurse, who choose not to. There are babies who need more.
Right.
But I would love to see something that, was healthier and didn't
that was actually food, you mean?
Yeah. I mean, all this corn syrup. I'm like, why? Why would we do that?
Because we have an extra amount of corn syrup. It's easy to produce. It's cheap to produce. And it's not toxic. Immediately toxic. It's toxic over time, but nobody ties that up.
Toxic.
And exactly, but nobody ties that in. It's like nobody thinks that, I was raised on corn syrup. That's why I have diabetes, I'm obese, and I have heart disease.
Yeah, I mean, it's so terrible. And it's like I wouldn't want to drink that. I mean,
no,
it is pretty, and I mean, it's pretty gross stuff. And I don't know why that became what we do with children. And and I also hear a lot too. I mean, I can't tell you how many pediatricians will tell the mom, well, the baby starts to have reflux, and they'll say, well, stop, take dairy out of your diet and add this, but go ahead and keep going with some formula supplementation. I'm like, do you understand what's in formula? Because I'm pretty sure it's cow's milk protein based.
Well, they'll just change the genetic formula. I'm thinking toxic waste dump.
Oh yeah. It's pretty gross stuff. And like I said, we need it. There's many families that need it. We actually need to find a better option. We need to create a better formula because what we have is not growing healthy children.
No.
Yeah.
I agree. I agree. It's that whole shift it's a whole shift in paradigm. And it's also, sometimes what's easy is not really the best road. And sometimes you have to work a little harder to reach, and parents are overwhelmed. So if they don't have the support, if you have one of the places that we have to change the paradigm is in the pediatrician's office. The people that they're listening to, the support people that they listen to, have to be able to give them options that are healthier. Because, if you're an overwhelmed parent or you're going to someone for help, then the idea is that you're trusting that person. And so what they say is some road that you're going to follow. And if they don't give you the proper information, you're just assuming that they're there to help you and do the best they can. And if they're not educated enough, you're going to get a limited amount of education or a limited amount of information. And you're going to be making choices, kind of from a place of ignorance. You don't have the other option.
Right. And, I
So-
would be okay with pediatricians they don't need to become lactation consultants, but they need to start
Absolutely not.
understanding their limit and say, hey, I didn't get a whole lot of, infant feeding education. Let's pull in a lactation consultant. I don't really know, about this, baby's plagiocephaly and this head tilt stuff. And I don't really know much about that.
Right.
Let's pull in a chiropractor and grow our team here and, refer, because they really are almost like a gatekeeper at this point. They just need to do a little bit more referring to some alternative, I suppose, providers, since we're both more a little bit out of the allopathic system.
Yeah. It needs to be a much more open conversation. And you're right, you need to understand where you're. I always tell people when I talk to chiropractors and I talk to people who are, getting out of school, how do you deal with this? How do you deal with that? I say, look, the best thing for you to do is stay in your lane, know where your lane is. And then if it's outside of your lane, is to find somebody that's to support either you or your patient in learning those procedures. It's like, but become an expert in your lane. And then from that point in time, you can look out and reach out for help from other areas. But if you at least not going to start to throw information out that is confusing, you won't be as judgmental because you know what your limits are. That's the other piece, is if you know what your limits are, then you shouldn't be judging other people who are outside of what, that box that you live in, because they have a different viewpoint or a different alternative. Nutrition is not a strong education factor in the medical educational process.
It's really not.
It's really not a big process for them. So exactly. So in the chiropractic realm, it's a little bit stronger. And then there are chiropractors who, specialize in nutrition. And, that's a big world, nutrition. It's not,
Absolutely.
not a small world. It's a big, complicated world in a lot of cases. Yep.
Yeah. Actually, I was going to say my chiropractor got me started on my personal food journey for the last year and a half, because she brought it up and was like, I'm seeing this stuff with you, and I really think some nutrition could make a difference. Here's some, things to look at. Here's some resources. And she kind of opened that door for me. And my primary, nobody else had ever brought it up. I brought it up after that to my primary, and they were like, no, that's not going to affect anything. Don't worry about it. Eat whatever you want. I'm like, what we eat makes a huge difference in how we feel. And for me, it's been life-changing. It's totally changed my chronic pain. And so it's been huge. And I owe it all to one of a really wonderful chiropractor.
It's important. Like I said, if I have a patient, I don't have a patient, I'll do the same thing that your chiropractor sound like to do to you. I keep seeing what's happening to you is actually, an inflammatory response, kind of organic response. You really need to look at what you're eating and your diet. I can give you some direction, but if you really want to take this under control, you need to see somebody who's really going to help you move through this process, or find it out by yourself. But I think that's a very important factor, is to make people aware of what they're putting into their body and how their body's processing it can be a big factor in how they're feeling, or how they're feeling badly.
Yeah. And I think it goes back to what we're saying.
Be able,
we got to stop normalizing dysfunction.
Right. Exactly.
So,
exactly. It's not okay to I love when someone, I have sometimes someone will come in, I have a little diabetes. I'm like, really? What's a little diabetes?
Is that like being a little pregnant?
You have a little diabetes, right? It's like, I know, I don't think it's quite as crazy as that, but or someone, I have heart disease, 2 coronary bypasses, but that's not bad. I'm like, oh, great. So you have 8 coronary arteries. You only had 2 bypasses. You think the others are 100%? It's you can't compartmentalize your health. That's what that's the other pieces. You can't compartmentalize your health. Nothing in the body occurs in isolation. Everything affects everything else. And that's kind of the chiropractic paradigm. We always talk about that, is that, the nervous system is the controlling system, and everything that happens to you is processed, mitigated, and actually formulated by how your nervous system reacts to it. So that's one of the main controlling systems. And it's tied in with the immune system, and it's tied in with all the other systems, digestive system, respiratory system. They all tie into each other. But the underpinning of all of it is the nervous system. And that's what we do as chiropractors. And that nervous system is functioning well, then anything else you do will have a greater positive effect. We see this with kids also. It's one of the things we'll see kids who go to, we talked earlier before offline about OTs and PTs and how they help to work with kids. What we find often is if a kid is going to, let's say, an OT for some kind of developmental issue, and then starts to come into our office and we start to make adjustments, as their nervous system gets better, one of the things the OT will say to mom goes, I don't know what you're doing, but Johnny's making more progress in the last 3 weeks than he did in the previous 6 months. And the reason is because now his nervous system is functioning and he's able to integrate the work much better. So yeah, that's what we need to do, is we need to start from the basis, from the foundation, and build ourselves up from there.
Well, I think the number one difference is the allopathic medical system chopped up the body into all these different specialties, all these different parts, and they act like nothing from one section interacts with another. And we need to pull it all back together. And we need to have, someday I would love it if we all had, naturopaths or functional meds as our primaries, but there aren't enough of them yet.
Right.
But,
no, not yet.
I think this is what you're doing in Boston is absolutely wonderful, and how you were able to really help so many families, and you change lives. You really do. And I think what really is amazing to me is not just the lives that you change directly, because we're all limited by the number of hours we can do that in a day. But by teaching you guys, by writing a book, by teaching other chiropractors, you guys are able to affect so many more lives and really help people on their path for wellness.
Right. I agree.
So I just want to say thank you so much. This has been absolutely wonderful. And I'm so thankful that you reached out. We can work on getting more people to stop normalizing dysfunction and to start looking at, at where things are working and where they aren't, and to bring in people like pediatric chiropractors. I pretty much refer nearly every client to a pediatric chiropractor.
Right.
My number one thing. So thank you so much for your time. And I really appreciate you.
Thank you for having me, Katie. And if people do want to find, besides the ICPA that you talked about, pediatric chiropractors, if you go on drmartinrosen.com, we have a whole certification directory of people who've been certified by us over the years. So again, you can find it there, as well as on the ICPA pediatric chiropractors in your area.
Thank you. I'll put that in the show notes. That'll be wonderful. Thank you so much.
Awesome.
When you change the way you look at things, the things you look at change you. I hope that you enjoyed the podcast today and learned something new. If you know someone who would benefit from this podcast, please share.